Contraception, the real story. Mechanisms, efficacy, risks, and side effects from Catholic Couples NFP. Contraception is the use of mechanical or chemical agents before, during, or after intercourse to prevent conception. In this presentation, we will discuss the different methods of contraception, their mechanism of action, effectiveness, risks, and side effects. Research on contraception makes use of two categories to refer to effectiveness rates for avoiding pregnancy: perfect use effectiveness and typical use effectiveness. Perfect use is when a method of contraception is used consistently and correctly. Typical use is how typical couples use the method. They don't use it perfectly, but do not stop using it. Types of contraceptives: withdrawal, condoms, spermicides, diaphragm, hormonal contraceptives, LARCs. Withdrawal, condoms, spermicide, and diaphragms are all contraceptives. Barrier methods don't interfere with ovulation. They prevent the sperm from fertilizing the ovum. Withdrawal. The withdrawal method is when the male withdraws his penis from the woman's vagina prior to ejaculation. With perfect use, this would result in pregnancies in only 4 of 100 women in a year's time. But with typical use, including those times where withdrawal did not occur in a timely fashion, 25% of women will become pregnant within the first year. Condoms. Male condoms are usually a latex sheet which is pulled over the penis prior to sexual intercourse. With perfect use, there is a 2% chance of a woman becoming pregnant within the first year, and with typical use, there is an 18% chance of a woman becoming pregnant. Perfect use means keeping the condom on throughout the entire sexual encounter. That's why the typical use has a high rate of failure. The female condom has a 5% chance of a woman becoming pregnant within the first year with perfect use, and a 21% chance of pregnancy with typical use. Spermicides. A spermicide is a barrier method that kills male sperm before it can fertilize the female ovum. Types of spermicides include foams, creams, gels, suppositories, and films, which are inserted into the vagina prior to sexual intercourse. If these are perfectly used, that is, if they are inserted according to the directions at the appropriate time, then 18% of women will nevertheless become pregnant within the first year. However, with typical use, 28% of women will become pregnant. Diaphragm. A diaphragm is a cap that is placed over the woman's cervix, the opening to her uterus. It is a flexible ring that is fitted by a medical doctor. The diaphragm is usually used in combination with spermicide, which is put on the diaphragm before the woman inserts it prior to having sex. With perfect use following the directions, there is a 6% chance that a woman will become pregnant within the first year. With typical use, there is a 12% chance. These barrier methods are only partly effective. An average 1 out of 4 or 1 out of 5 women will get pregnant each year. Hormonal contraceptives. The hormonal birth control methods require introducing unnatural man-made steroid hormones into a woman's body, usually a combination of chemicals to imitate progesterone and estrogen hormones. Each of these methods has approximately a 0.3% chance of pregnancy within a year with perfect use, and a 9% chance with typical use. That means that with typical use, 9 women out of 100 will become pregnant within the first year. Oral contraceptive pill. The first of these hormonal methods is the oral contraceptive pill. This is a pill that is taken every day. The pill is a combination of synthetic estrogen and progestin. These are not natural hormones that are bioidentical to the hormones that our body makes naturally. They are synthetic, artificial chemicals that mimic the action of estrogen and progesterone. Contraceptive patch. The contraceptive patch is a transdermal patch containing a combination of the hormones estrogen and progestin. It is placed on the abdomen or the upper torso. Generally, there is 1 patch for each of 3 weeks in a row, followed by 1 week without a patch. Contraceptive ring. Another hormonal method is the contraceptive ring, the most known of which is the NuvaRing, which also releases a combination of estrogen and progestin. There are progestin-only pills, also known as mini pills. Injectable contraception. There is also a progestin-only injectable contraception. The brand name is known as Depo-Provera, and it's a long-acting progestin that is given as a single injection every 13 weeks. It takes a very powerful dose of a steroid hormone to shut down your reproductive system for 13 weeks. So, although these methods of steroid hormonal contraceptives are more effective than barrier methods, 1 out of 10 women will still become pregnant every year on average. Long-acting reversible contraceptives, LARCs. LARCs are IUDs and implants. These are reported to be very effective at preventing pregnancy. They also act as abortifacients if ovulation occurs. IUDs are devices inserted into the uterus. There are 3 that are currently approved in the United States. These are T-shaped and are inserted in the uterus. A risk that is not often explained properly by medical doctors is that they don't always stay in the uterus. There is a tendency for them to migrate and penetrate the uterus and then move to various parts of the body where they can cause pain and injury. Thousands of lawsuits have been made against the IUD manufacturers. Women are claiming that they suffer great pain, that they have suffered injury to other organs, and that they've had spontaneous abortions. It requires major surgery to remove these devices once they've migrated. LARCs are the most effective artificial birth control. Once implanted or inserted, they have perfect and typical use failure rates of less than 1%. That means that only 1 woman out of 100 will get pregnant each year. Steroid hormone method. The steroid hormone methods have 3 mechanisms of action. They sometimes act by preventing ovulation or inhibiting sperm motility, and in these cases are acting as a contraceptive. But the 3rd mechanism is the one that the pharmaceutical industry and medical societies don't like to acknowledge. When they fail as contraceptives and conception has occurred and a new life has begun, they act as abortifacients by thinning the lining of the uterus and preventing the implantation and growth of the embryo. This causes the embryo to die. Preventing implantation, which a human embryo needs to be nourished and grow, is an early abortion. There are many different types of steroids, and they are used for different things, but they all genuinely have an anti-inflammation and a reduction of swelling mechanism of action in the body. In medicine, it is usually good practice to prescribe steroids cautiously and sparingly. The inflammation of swelling usually resolves within hours or days. Doctors are especially cautious with injured athletes because of both short-term and long-term effect of steroids. But with hormonal contraceptives, and especially LARCs, they continuously release synthetic steroids in the woman's body for up to 10 years. The difference is that with athletes, the doctor is trying to cure an illness or injury. But the function of the hormonal contraceptive is to make a healthy reproductive system sick. The woman's body is continuously trying to regain its equilibrium, and the steroid hormones need to be continuous to prevent pregnancy. Risks of hormonal contraceptives on women's health. A meta-analysis on the effects of hormonal contraceptives on women's health was published in 2021. It reported increased risk of the following: HIV transmission, breast cancer, cervical cancer, Crohn's disease, ulcerative colitis, lupus, multiple sclerosis, female sexual dysfunction, bone fractures, fatty weight gain, cardiovascular and thrombotic risks, strokes, depression, mood disorders, and suicides, increased number of abortions, exploitation of women, more divorces with negative effects on children. Women seeking birth control have a right to know about how to avoid these risks by using effective fertility awareness-based methods. Fertility awareness-based methods. God wants couples to be generous in having children. Large families are spiritually rich. After all, children are the only thing we can take with us to heaven. But for good and just reasons, the Catholic Church does allow married couples to use fertility awareness-based methods to postpone having children, either for a short term or even indefinite time. This is also called natural family planning, or NFP. It's best to discern these reasons with the help of a holy priest. Some reasons might be maybe one or both of the spouses are sick with physical or mental health problems, or perhaps there are financial difficulties. NFP isn't simply a natural version of contraception. Instead, it's a true method of family planning that is used only after prayerful discernment about God's will for that family. There are many variations of NFP methods, but they are all based on some combination of a woman's sensations, assessment of cervical mucus, and determination of the time of ovulation. Pregnancy is not a disease. A healthy body should not be subjected to medicine in order to create a diseased reproductive system. Generally speaking, men are always fertile. Women are fertile approximately 6 to 8 days in each of their menstrual cycles. Fertility awareness-based methods of NFP are based upon determining those fertile days and abstaining during those days, or having intercourse on those days the couple is trying to have a child. In order to identify fertile days, the basal body temperature at the time of ovulation and hormone levels can be used to predict and confirm the day of ovulation. The perfect use of these NFP methods can be up to 99% effective. The best independent research available indicates typical use effectiveness rates of 86 to 98% for NFP methods. However, the studies by the Creighton and Billings organizations indicate that when used by a devoted and committed married man and woman, they are 98 to 99% effective.